Hi, everyone. In this video, I'm going to talk about one way to think about your initial capstone question. Again, this is just one way. I know we've talked about other, types of questions in your evidence-based practice courses and, with the library. But this is kind of a little bit more specific to capstone and the capstone process. So one way, again, to think about your initial question is thinking about, settings that you're interested in working in. And those could be, from really traditional to really non-traditional, right? So, a wide spectrum of settings. Populations, similarly can be all over the map, and interventions that you're interested in focusing on. So those are three main kind of elements to the capstone question. Now I know there's, if we think about PICO, it's population, intervention, outcomes. Certainly you could have outcomes as part of your question as well, and how they're tied to any of these elements, right? So absolutely, like there could be other elements like outcomes. Sometimes population and setting might be really similar, right? The setting determines the population, or vice versa, or intervention, right? So there's a lot of ways to think about this, but one way is we can think about population, setting, and intervention. So when you're thinking about the question, I think, again, at this stage, it's good to keep it broad in some respects, but to also think about what are the specifics that are most important to you. Okay. And I have some examples. So if you are really interested in a specific setting, right, then your initial question may be more focused on a specific setting and more broad in some of the other elements. Okay, so an example, and I've done this again around my own kind of interests. I think about if I were going to be doing a capstone, working with adults and older adults with intellectual disabilities, some examples. So if I had a question that was focused on a specific setting, I could think about what are effective interventions for supporting community participation for people that live in group homes. So you'll notice here that I didn't specify intellectual disabilities. There's a lot of different folks that could live in group homes, so if I'm more interested in kind of the group home setting rather than the population, I don't necessarily need to specify the population at this point. It could be people with maybe serious mental illness, or folks who have experiencing housing instability, or traumatic brain injury, right? There's a wide variety. So maybe I want to broaden out and focus on group home, interventions. And you'll notice too, I didn't really specify very specific interventions. I did want to look at community participation as kind of an outcome related to intervention, but, not necessarily a specific type of intervention. It could be individual, it could be group, could be population based, right? So anyway, this is one example of if you have some really clear ideas about the type of setting, how you might be able to craft a question. Similarly, right, if you know that there's a specific population, or I would also use, the term community for sure, in this example, right, then maybe your question is more focused on a specific population. So again, in this case, maybe I am really interested in working with older adults with intellectual disability. That's really what I want to be doing. I don't really, I'm not super particular at this point about the type, the setting, or even like what exactly we'll be doing, but that's kind of what who I'm interested in working with. So maybe my question is something like, what are effective occupational therapy interventions for older adults with intellectual disability? So again, you can see how I didn't specify any sort of setting, right? Interventions pretty broad in terms of just saying occupational therapy interventions. And then, if we're thinking about a initial question focused on specific intervention, this could be like if you have a real specific interest in a type of service delivery, a type of intervention, then maybe your question is more specific about this and less specific about population and settings. So again, in this kind of general area, right, life story work is a type of intervention. And so if I'm really interested in focusing on that for my capstone, maybe my question is something like, is life story work an effective intervention for supporting quality of life for older adults? And so again, a broader kind of population, right? Not really specific setting, that sort of thing. So, some things to think about here. And how does this relate then? So if we go back, right, all these three things, population, setting, intervention, will help us start to think about what is a good capstone site for you and your interest, right? So again, if you have some really specific ideas and want to have, form a question that's really specific to setting, then we can start looking at, those types of settings. Whereas if you're interested in, and maybe the type of clients you'll be working with might be, pretty broad or varied, or we just would kind of find a setting that, is interested in you, in supporting you for your capstone, and not really worry too much about the population, right? Conversely, if you're really interested in working with specific population, maybe we look at a lot of different types of settings. I can think of an example, like for example, autistic children, for example, right? If that's really a population that you want to be working with, maybe we're looking at school programs, outpatient pediatric clinics, maybe some of the hospitals, maybe some community-based organizations, maybe some advocacy groups that specifically work with autistic children and their families, right? So there's a wide variety of potential settings, but all focused around that population. Same intervention, we could think about a lot of different potential fits that would be interested in the intervention type, right? Now, sometimes intervention and setting will go, together. I'm thinking of if you're really interested in hand therapy, right, then setting would really fit into intervention, right? But if intervention, you're really thinking about, let's say, for example, arts-based interventions, again, the population setting could be it could be an inpatient, could be an outpatient clinic, could be a community-based organization, could be working with children, could be working with young adults, could be working with people with disabilities, maybe physical disabilities, or maybe psychiatric disabilities. So I say all this because I want people to consider that if you have a very specific question in all of those areas, then, there are very specific sites that would be, good to think about for those. And what can happen is, one, we obviously need to have sites that are interested and willing to support students. And so sometimes the more specific the question, it can be a little bit more challenging to find a site that meets all of that criteria, particularly if you have a geographic location you're interested in staying in. Now, if you are able to really go anywhere and that's not really an issue, then sometimes the specificity is fine. We might be able to find somewhere, and we often can find somewhere. So, but if you have some other considerations, right, there's a lot of factors that go into it. Again, it's good to think about, what are you most interested in? Are you most interested in kind of the setting aspects, the population aspects, or the intervention aspects? And how can we kind of take all that into consideration as we start to think about your capstone? So I hope this is helpful, and I will see you all soon.